Hello, everyone, and welcome to sqadia.com. I'm your educator, Dr. Ali Imran, and today's lecture is on Neuroimaging Part 2. Now, for the Part 1, you have to watch my other lecture. So, for this lecture, here is the outline of it. We will learn about what is a movement disorder, what kind of movement disorders occur, what are their different types. Then we learn about their modalities. Then we learn about that not only cross dysfunction happens, sometimes there's even focal dysfunction. Then we learn about the neuroendocrine dysfunction, that how it affects our body. Then we learn about the epilepsy and the seizures, and lastly the dementia. So, further explaining, we'll learn about the movement disorders, that what is a movement disorder and how it is linked to our brain. Then we'll learn about the different modalities. Now we know what is an MRI or CT scan, but what is an functional MRI? What is a spectroscopy? What is a PET scan? What is a SPECT scan? We'll learn all of this in this lecture. Then we learn different examples for it, like NPH. We learn that the neurodegenerative disorders can not only happen crossly, that can even happen in a focal area. So we learn about those. We learn that how they are presented on various images. A lot of examples will be given, they will be discussed, they will be presented to you with all sorts of presentations. Then we will move on to our topic, the neuroendocrine dysfunction. We'll learn then what is an endocrine gland, what is an endocrine system, what is a pituitary gland, what its role, why it's called the master gland, what are its different lobes. Then we learn its different problems, how it can be damaged, what different states might arise from it, and how they're presented on various images and modalities. We learn all of them along with various conditions in this lecture. Then we'll move on to the epilepsy and seizures. We learn what is an epilepsy and what is a seizure. We learn what are different types. We learn how they are presented, how they occur, how they are exhibited in a patient. We learn what is the role of the hippocampus in such a patient and how to differentiate it from the normal presentation. We learn about the other examples. We learn about dementia. What is dementia? How do we define it? It is not just memory loss. A lot of different features comprise dementia. We learn about those. Then we learn that dementia also includes the Alzheimer's disease. Now, what is Alzheimer's disease? How it is exhibited, how it is presented in the patient, what are the UBWs. Then we learn about that dementia not only is presented as UBWs, it can be other types like microangiopathy or many others. We learn about all those. We learn about the role of the hippocampus. What is hippocampus? What is its role and why it is specially linked to dementia? Then we learn about the Pick's disease, how it is different to regular dementia. You can find this lecture along with part 1 of this lecture among thousands of other medical lectures on sqadia.com. You can even start your free trial. You can find topics from anatomy to biochemistry, from courses in medicine to pathology to biochemistry. You can find all sorts of medical educational needs in sqadia.com. So, thank you so much for watching sqadia.com.